Anatomy and Physiology. Hey guys, it's Dr. Sean, and today we're doing week 2 of Anatomy and Physiology. So, integumentary and musculoskeletal systems. Some of the more fun ones, and usually the ones we jump in right away. There's a lot of stuff going on here, so let's jump right into it. See, we've got discussion posts coming up on Wednesdays. Don't forget to complete the actual question and respond to 2 people. Okay, so make sure you're doing full sentences and stuff like that. I want you guys to get full credit on this because it's like 25%, I think, or 20% of your grade, which is enough to really jump you up a couple grades if you're having problems with other stuff. And they're relatively easy. Okay, integumentary and body temperature. That's a good one. So we're going to talk about sweating. We're going to talk about shivering. We're going to talk about the erector muscles and stuff like that. Skeletal system and muscular system. Now, I have other videos on YouTube already on the muscular system and the skeletal system. And I don't know if I have integumentary, but I think I do. I'd have to look for that. But you can look for those on my channel under the playlist Anatomy and Physiology. All right. Let's see what we have here. Textbook. You're going to have to do a lot of reading in this. Skim through, take a couple quick notes on stuff you know that you know, you're okay. Okay, lesson 1, let's see, the skin. We're going to go through this as fast as we can, but there's like 3 different modules in this module, this work week. Introduction, learning objectives, skin. The skin, okay, so the skin comes in 3 layers, 3 main layers. That's going to be the epidermis on the outside. It's going to be the dermis in the middle. It's going to be the hypodermis or subcutaneous. This is the cutaneous system, okay? Maybe we've talked about, or maybe you've seen sometimes in other parts, we'll talk about the mucous membranes. We'll talk about serous membranes. We'll talk about synovial membranes. Those different membranes, those are coverings, but the skin is the cutaneous membrane, basically. And it's the covering of the outside. The integumentary system keeps the integrity of the skin, of the inside stuff on the inside and the outside stuff on the outside. Those 3 layers. The epidermis is the skin that you see. Okay, this has a bunch of layers in it as well. It has the stratum basale, which is the base layer where everything starts up. And it has the stratum spinosum and corneum and all this kind of jazz. There's a whole bunch of them in there. And like here in the hands and the feet is lucidium. Okay, there are different kinds of just terms that relate to the different levels we see in the microscopic world. Okay, now in the epidermis we have a couple things going on. It's the openings for the glands. A couple things. There's sweat glands, there's eccrine sweat glands, there's sebaceous glands, and there's hair follicles that come through there. Now underneath that is the dermis. Dermis is the heavier part, that's the thicker part, and that's where basically everything is going to show up. You're going to have your hair follicles, you're going to have your roots, which is the root, right? You're going to have your gland tissue, actually, the actual gland is in there, the eccrine sweat gland, the sebaceous gland, the erector muscles, which is the muscle that pull up your hairs when you get all cold or freaked out. They give you goosebumps, right? Other stuff that's in there is nerve cells and some other fun stuff in there as well. Let's see what else. Dermis. Hypodermis, or the lowest layer, is the hypodermis is the subcutaneous, and that's what we get into there. Other fun stuff too, we have what are called accessory organs. Whenever you have accessory organs, you have the main organs, then you have accessories, or stuff that helps it out. Fingernails and hair. Those are the main accessory organs that we have. Now if you look at your thumbnail, for example, I don't know if you can see right there, but see that light white part? Looks like a quarter moon, or a moon rising, right? That's the lunula. That's what it's called. The body, you have a cuticle way down to the bottom, and sometimes you cut your cuticle and it hurts forever, like I did earlier this week. Different apocrine and eccrine sweat glands you can read about. There's a bunch of, cerumen, all this kind of fun stuff. Good. Temperature, skin disorders. Let's see. In there. Oh, wait. Flip that this way. Nope. Yes. Hang on, I'm opening too many windows here, guys. Skeletal system. There we go. We're going to go over things like lesion preparation. Ooh, that's good. Body temperature activity. Remember, this is Mr. Shepard. They're talking about body temperature. That's what they were talking about when he was shoveling snow or whatever that assignment was. Skin lesions. We're going to talk about things like pustules and warts and fissures and abrasions and petechiae and stuff like that, which are all different kinds of fun, different parts, so of skin. So now with skin too, other things that happen in that stratum basale, as those cells are being built, they eventually lose their nucleus, and they are not allowed to make any more and repair themselves. So they just die and fall off. But they become keratinized, which makes them waterproof. That's why we are waterproof the way we are. That's a good basic idea of that. Structure of bones. There's many different kinds of bones. There are, I'll show you a little bit. This is a spinal bone. This is a vertebra. This is irregular looking. This is called an irregular bone. These are short little bones in here, and they're called short bones, like these. These are long bones. They're called long bones. Flat bones are flat, like the scapula, for example, or skull bones are kind of flat. This is a long bone. This is the humerus. This is not very humorous. It's not quite funny as you think. Humerus and humerus. O-U-S is funny. U-S is an arm bone that goes right here. So it has two different parts, main parts we're talking about. Diaphysis, right here in the middle. This is the diaphyses. Diaphysis is one, diaphyses are many. So I have diaphyses, long bones, right? So if these are the diaphyses through here. These are the epiphyses at the ends. Epiphyse, epiphyse. That's the end of the bone. The end of the bone, too, is the distal epiphyse, further away from the body. Proximal epiphyses, also called the head of the humerus, right through here. You have a surgical head and an anatomical, or a surgical neck and an anatomical neck. There's also these tubercles, greater and lesser tubercle. There's also ridges. There's little tiny fossa. There's the olecranon fossa right here in the back. That's where your elbow connects in. And there's the ulnar fossa in the front. So we have these little areas in here. You have a capitulum, you have trochleas, you have, oh gosh, all these ridges and all these different parts of the bone. So make sure you're a little bit familiar with those. At least those are parts of the bones. As you get more detailed, you'll start to learn what each, there's a deltoid tuberosity down through here, which is a tubercle. Tuber means potato. This is lumpy thing, that's what potatoes are, is just lumpy. Okay. Different functions of the bones are, they not only maintain your structure, they allow for pulling on muscles, so they're hinges and they're pulleys, but they also allow for the creation of blood cells, which is called erythropoiesis. Now remember, erythropoiesis is a process in the red marrow, which is up in the ends of the bones, called the epiphyses, usually in a place called the red marrow or the spongy bone area. And then in here we have a medullary canal. We cut it this way, transverse cut. Look at it this way, which would be a little circle, and in the middle there you'd see marrow, and it's yellow marrow. That's what makes soups taste so good, and dogs go crazy for it because there's a lot of nutrients in there. That's fat storage. Okay, structure and functions, divisions of the skeleton. We have here Skeletor up here, and he's got the axial skeleton in the middle and the appendicular on the sides. Axial is going to include the rib cage and ribs, okay, spine and head, and sacrum. Everything else is going to be the appendicular skeleton. Okay, that's the arms and the hands. So we have phalanges, which we have on the toes too. Phalanges means pokey things, right? And here's the difference with phalanges. You have 5 on each hand, but how many phalange bones? Very specific question. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Right here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. There we go. Metacarpals are here. Phalanges are here. Metacarpals, we have 5 on each hand. So if you're thinking, wow, I got to learn 206 bones in the human body, that's incredible. That's a lot of bones. It's not. 14 is 28. 28 is what? 56, right? So we have 56 bones. So 56 bones just in the fingers and toes. Then we add 5, 10, 15, 20 because we have metacarpals and metatarsals on the foot. That's another 20 bones right there. So now we're almost at half of what we would need for the rest of the body. Everything else is divided up into side by side, right? So we have bones on this side, bones on this side. So we have 12 ribs on 12 pairs of ribs, right? And then we have 12 thoracic vertebrae, 5 lumbar vertebrae, 7 cervical vertebrae. The way to remember those is 7 for AM for breakfast is the neck. Thoracics is 12 for lunch, and 5 p.m. for dinner, which is the lumbar. Okay, 2 legs, femurs, patella, tibia, and fibula. Okay, then we get into the other ones, little details of there. I have some other videos that you can look up on YouTube which you can see on those. Let's go down through here. Special features, skeletal disorders. Skeletal disorders is pretty interesting. There's a lot of them. Many of them can be like osteogenesis imperfecta, which means the bones grew not perfectly like they should. And there's many different, like brittle bone syndromes, and you can have osteoporosis and osteomalacia. Those are different things. Those are not genetic necessarily. Those could be because of activity as well. And then you go into skeletal muscle is the next one. Now muscles, I did a whole thing I think on muscles as well. We have a few different things with muscles. There's about 600 muscles. There's so many. You have 5 layers of them on the back alone, and we have so many that interconnect and overrelate and all this kind of stuff. The shoulder, for example, has so many muscles. It's not just the rotator cuff, which is going to be your supraspinatus, infraspinatus, teres minor, and subscapularis, but it's also going to include your pectoralis major and your pectoralis minor and the deltoid, which is like 3 parts, right? Then you have your bicep brachii and your tricep brachii. But wait, there's more. There's ones inside there that attach from here, right, to here, called the coracobrachialis, or from here to here, which is the pectoralis minor. Those are going to guide not only this guy, but also help move the arm. They help move the arm up and forward. So there's a lot of range of motions in there. There's a lot of things to know with muscles. If we were really getting into a in-person class and had time to do it, we would want to know some things about muscles. Number one, their origin, where they start and where they end, is the insertion. The origin of the bicep brachii is up here. Bicep means 2 heads. There's 2 heads, one that goes into the humerus itself, right through here, and right through here. And there's another one that attaches up in the scapula. Okay, that's the origins. The origin is where it pulls from, and then it pulls on the insertion. The insertion down here is the radius, which is the bone inside here. So as we get into those bones, or those muscles, we then have a function. What is the function of the bicep brachii? Flexion of the elbow. That's what's the function of it. Now, the last part would be the neurology of it, which we don't have to worry about in this class. Thank gosh, right? Next thing we get to do, that's already 12, discussion for survival. Consider the primary functions of the muscular system. How do these functions critical survival? Well, the functions of the muscular system are what? They're to get you out of a situation if it's dangerous, right, by moving and running. It's to get you to something that's good, and it's also to increase heat. So it does create heat as you move. Oh, very good. So you can look at the rubric. Now go to the screen, which I'm going to show you right here real quick. Okay, you go through, there's the discussion on survival, right? There's our discussion. If we go right up here, there's 3 little dots. You press those 3 dots, it's going to bring you a thing called the rubric. And the rubric, as you remember, hopefully, is, let's get that in there. The rubric is the how I'm going to grade it. It's not the willy-nilly part. It's just how I'm going to have to grade it, okay? So do that, and make sure that in the discussion you answer to other people, okay? At least interact with somebody, right? So we can get the better information on that. I'll be scheduling the Zoom meeting soon, so keep an eye on the announcements and for your emails. And then we have lab studies. Okay, lab worksheet. Very important, guys. For the lab worksheet, you need to download it. So right-click on it, download it onto your computer, and fill it out from there. And then save it as either a doc file, a docx file, or a PDF, only I can't read it any other way. You send me a photograph, I'm not going to be able to do it, okay? So I've already been able to download it real quick like, and I'm going to read it to you. 3 to 5 well-developed sentences. It's a good idea. Spelling and grammar makes sense. 10 years old, in past years, has several fractures, even though she is not an active child. A recent blood test indicated alkaline phosphatase level was high and elevated. Here's how to look that one up. Look up bone diseases in children. Look up fractures in children. You'll see all kinds of different stuff on that, but that's pretty general. Now, if you look up like high alkaline phosphatase in children, that'll give you what the diagnosis is for this, okay? And then you can look up some history. What are some treatment options? Treatment options, if that's the diagnosis. The next one is muscular. Respiratory infection during the period of multiple IM injections. She was discharged with orders to continue the injections until the doctor advised her to discontinue them. The nurse staff had been injecting the medication into the gluteal area, which is the rump. This area is becoming sore from all the prior injections. What options might she use for the future to avoid pain in the area of the injections? So what should she do, or what should the nurses do? That's the question. So you should ask when you're giving someone injections, have you had this before? Where did you have your injection before? Let's look at the injection site. If it's bruised or red, try somewhere else. Where else can you get IM injections? IM is intramuscular. That's going to be the deltoid, shoulder, and the gluteus medius, which is on the upper, like if we look at this guy here, it's up through here. If we go down through here, you could hit the sciatic nerve. We don't want that. Okay? So go ahead and answer those how you do, but answer them on the sheet, save it, and send that to me as the response. It'll say like turn in assignment or something like that. Okay? So we go through that one, review the glossary. It goes through. Very good. That's easy. I think you guys can do that pretty simple. That's 16 minutes, man. And then you have the quiz. The quiz, go through. You have 2 tips on the quiz. That should help you a lot with that. It's not too hard. Take your time. You have about a half an hour to do 10 questions or 20 questions, whatever it is, okay? That's it for week 2 of Anatomy and Physiology. You guys, take care. Do your homework. Contact me if you need anything. If you're having problems getting online, contact your coordinator, your online coordinator. I'll do what I can, and we'll go from there. Okay? You guys take care. We'll see you on the flip side. Bye.